Hi there. My name is Katie Swafford. I'm the Director of Counseling Services with Texas Baptist. And one of the questions that I get asked fairly frequently is, what can we do as a church to help with those that might be struggling with mental health issues? And I have some thoughts on that subject. So I am here today to bring you a presentation that I shared recently. I hope it will have helpful information on the types of mental health ministries that a church can offer. And if you have any questions regarding the information presented, please feel free to contact me. All of my contact information will be provided in the description and or at the end of the video. Thanks so much for joining us, and I hope that you have, or hope this information is helpful to you. Thanks so much. So as we get started, let me just remind you or introduce you if you're not familiar with Texas Baptist Counseling Services. My name is Katie Swafford, and I'm the Director of Counseling Services. I've been here almost 10 years in just a couple of weeks. And one of the things that I want to be sure that you know about us is that we're here to serve you. If you are in ministry in one of our BGC affiliated churches, we have a network of Christian counselors across the state that we would be glad to refer you to. If something comes up in your own life that you need counseling assistance, or if you are in a position where if you're in a ministry position and a spouse or children in your home might need counseling assistance, because you're a BGCT affiliated minister, we are able to offer some financial assistance toward the counseling as long as you meet with a counselor from our network. So that's first and foremost my responsibility and goal here in serving you. And then secondly, in addition to that, what I am here to do is serve as a referral for all types of information. If you have families in your church, friends, loved ones that might need counseling resources, please feel free to contact me, and I'd be glad to offer those referrals from our network. And sometimes it even means some consultation and brainstorming with you a little bit to kind of determine what resources are available, what's out there, what the best options are, etc. So I am here to serve you and want to make sure that you know that. So keep in mind, if you're a BGCT affiliated minister, certainly contact me if I can be of service in connecting you to a counselor. And then in addition to that, I'm glad to provide consultation and referral for anyone who's looking for counseling resources to do that. My contact information will be at the very end of this presentation, but certainly if you found this webinar, you might have possibly come across that information through social media. You can also reach out there's contact information there. You might have gotten this in an email, and my contact information is there also. So hopefully you'll be flooded with my information should I be of help and of service to you. But here we go. Our purpose today is to talk a little bit about types of mental health ministries. This is a question that comes up fairly frequently. It's not something a question I get every day, but it is a conversation that has been out there for some time about how churches can get involved in and participate in mental health needs and ministries. And then I think even from what we've seen in coming through the pandemic, if you want to consider that we're out of it yet, or at least on the tail end of it, I think it's highlighted the fact that we as churches can possibly do some things to help serve those who are struggling with mental health issues. So that's our goal and our purpose today. And I should say up front, of all the information that's presented, this is not exhaustive. There is no way to potentially cover every possible ministry scenario, ministry context, ministry opportunity. So what I'm presenting to you today are some of the most common ones, some that I know churches have already engaged with or in, some that I know are specific to Christian context and could be helpful and easily accessible to you as a church. So please know, and I'll try to remind you, this is not exhaustive. These are just ideas to get the ball in the conversation rolling. All right, so let's start by just having a real brief conversation about why a mental health ministry. Why is this something that could be helpful or might be of interest for you and your church? Even before the pandemic, statistically, we know that 1 in 5 will have a mental health issue in a year. So for the sake of really easy math, if you take, if your congregation has 200 people and you divide that by 5, you're going to get 40. So therefore, roughly 40 of your church members in a given year are going to have some type of a mental health issue or be impacted in some way by a mental health issue. So that's one of the things that for some of our churches, it helps us to open our eyes a little bit to the fact that this isn't an out there. This is a we conversation. We all are engaged in mental health issues, whether that is our own personal experience or someone in our family, a friend, coworker, etc. We're all impacted and we're all touched by it in some way. Statistically, we see that. In addition to that, the pandemic has actually caused an increase in the statistics that we've seen. And if you look at, I attended a trauma conference recently, and the information was provided about recent statistics as of 2020. If you look at trauma, depression, anxiety, substance abuse, substance use, all across the board, those things have increased since the pandemic. So one of the things that we know is not only did we have mental health concerns in our churches before, but we also have mental health concerns in our churches now. And we can probably assume that those are greater than they were before. I've also heard some statistics referencing about 300 to 400% increase in the number of individuals going to their primary care physicians seeking medication assistance for depression and anxiety. So again, the pandemic has caused an increase. Another thing that research has shown us is that when people seek out mental health assistance, they go to one of two places. They either go to a mental health provider or they go to the church. Those are the two places that they will go first. And roughly the stats there are 50-50. So I will tell you right now, if you haven't tried to seek any mental health assistance, any counseling recently, many of our counselors are strapped. They're full, their schedules are full. And so there are many counselors who are not able to see people quickly, providers that are not able to get people in quickly. And so I would even suggest that there may be more individuals now seeking that type of information through the church than even has been in the past. So it's good for us as a church to start to think about this and be prepared to kind of fill in some of the gaps. One of those gaps in mental health assistance is that you may go to a provider and they may prescribe medication, or you may go to a provider for counseling, but there's a lack of, or there's not the ability to have that community support. And community is important to a holistic support for mental health issues. So that's one of the areas that the church can really step in and fill a gap there for those who are seeking mental health or struggling with those types of issues. And lastly, another thing that most, not all, because our Christian counselors, this would be an exception, but many providers are not going to be addressing the spiritual aspect of mental health issues. And again, when you start to look at research and statistics, and as Christians, we know that that's a key part of a holistic approach. And really, if we're body, mind, and soul, body, mind, and spirit, however you choose to term that, we need to be able to look at and feed that spirit part of us. And it's very important for our mental health as well. I have included here a verse that to me speaks to one of the reasons why we need to consider a mental health ministry as well. I really key in on the last part of this where it says, love your neighbor as yourself. If we're loving our neighbors, that means we need to try to be aware of the types of things they're struggling with, and as best as possible, offer them opportunities for love and service to meet them where they're at and be able to support them where they're at. If you're going to consider a mental health ministry, you definitely need to have some basic questions that you're asking. So I've provided here, again, this is very basic. There are additional ones that would be really helpful. But on a basic level, start to ask yourself, or those that you're talking with in your church, these questions. What are the needs? What are the needs in my community? What are the needs in my church? What is already available? And how I think of these two is if you know that in your community, there's a high need for, there's a lot of depression and anxiety, maybe there's been a rash of suicides, those types of things, and you recognize that depression, anxiety, isolation, those might be some of the stronger needs in your community, start to look at what's already available. Is there another group in your area that already offers some depression or anxiety support groups or resources that are available for them for support? Another example might be grief. If you look at your church congregation and there's a lot of grief that has occurred, But maybe you also know that in your community, the local church down the street has a grief share resource or a grief support ministry. Maybe it's not something that you need to duplicate as your church ministry, but maybe contact the other one and see how you can partner together, or take a look at if they're offering that, how can we help to support and funnel those who might need that resource to that church, but yet offer a complementary type of resource, maybe a depression support group or an anxiety support group or something along those lines. So look for ways to complement, not necessarily recreate the wheel or duplicate in a community. You also need to look at what resources can we as a church contribute. Some of the basic ones are what space can we contribute? What people can we contribute from a volunteer standpoint? What about the money that we have to give to something like this, and the time? Anytime you start a ministry of some sort, you need to have individuals who are committed, who can give the time, who are prepared, and who can make sure that, because these things don't just happen successfully without effort, preparation, etc. So if you have an idea to do a mental health ministry, but you don't see the volunteers in your church, then maybe that's not the right time. Might be an issue to pray on for a while, for the Lord to send those volunteers. Maybe you don't have the space, and so you need to kind of look at some different options. Maybe you don't have the money. Just keep in mind that with any ministry, planning, preparation, organization, someone who's committed and invested and willing to give their time, maybe even more than one person that's committed and invested, to be able to make sure that this ministry has some longevity and is able to sustain itself over a period of time. Just kind of as a side note, if you start a ministry, but you don't have already in place the people or the money or the time to secure that over a period of time, then that can be discouraging for those who have the mental health issues that are coming to your ministry or seeking that type of ministry. Maybe they are excited about it, but then they have a letdown if it's not able to get its feet off the ground, so to speak. So do a lot of groundwork, a lot of prep work, and make sure that you have the right people ready to contribute at the right time. Next I have, does my church support this ministry? I know that there are instances where ministry leaders have said, yeah, we really need to do this, but yet when they brought it to their church was not in favor. I would suggest to you that most likely, if your church is not in favor and in support of doing this, that means they're not going to help to promote. That means they're not going to probably help to funnel people your direction. And that might be a significant barrier or challenge for your ministry to be successful. So make sure that you have the church's support in that as well. And last, not the final question necessarily to ask, but the last one that we have here is, does this affect the church liability insurance? Anytime you bring on something that's a mental health ministry or any additional ministry that might be a little different than what you normally would have, it's really helpful to contact your church liability insurance to make sure that, based on what you were hoping and wanting to do, that they will still cover you. And or if you're wanting to move forward in this ministry, maybe there's additional coverage you might need to purchase. So keep that in mind. Contact your church's liability insurance and ask some questions about, if we were to do XYZ, how would that affect our liability insurance? And either do we need to add additional programs to that, supplements to that, in order to make sure that we're covering all of our bases. Again, these are just basic questions. But once you have started to think through some of these basic ones, then the next thing I wanted to offer to you is some low-cost options. Most of our churches are not in a position to be able to just put thousands and thousands of dollars toward ministries that are related to mental health. And actually, most of our churches are not necessarily in a position to start a counseling ministry. Some are, or counseling center, I should say. Some are, but some are not. And so I recognize that the majority of our BGCT affiliated churches are smaller congregations. So this is one of those situations where you don't necessarily need to start a counseling center, but here are some ways that you can help to fill in the gaps. Really easy, low cost thing, still wanting to make sure that you have the personnel available and those that are committed to do it. Maybe you try book study first. There are a lot of different books and helpful mental health resources. I'm just including a few here that I'm either familiar with that have really easy programs to implement, or they're in workbook style. You see here, Making Peace with Your Past, The Anxiety Reset, Healing Depression for Life, Boundaries. the Anger Workbook, which is actually one of my favorites, and the Daniel Plan, which is a book that incorporates food, family, fun, fitness, and faith. So there's an opportunity here to do something really low cost. Get several people together. Maybe if you just want to say, hey, we're going to do something that's mental health related. I think sometimes we forget that mental health is if you look at it from a holistic perspective, you're talking about diet, exercise, mental and emotional health and well-being, community and relationships. So there's a lot that we're talking about. So if you choose to do something that's a little more nutrition focused, or you choose to do something that's a little more exercise focused, maybe you get together a prayer walking group or a group that meets every 2 or 3 times a week to walk around a gym at your church, to walk around the outside of your church. Whatever this might look like, you can think about it from a holistic perspective. It doesn't have to be something that's focused specifically on depression, specifically on anxiety, on trauma, etc. But keep your mind open to starting some kind of group that can help pull people together, particularly after the pandemic. We're all looking for some connection. And through that connection and support, coupled with exercise, nutrition, community, and relationships, that in and of itself can be a helpful thing in filling in the gap towards mental health, those that are struggling with mental health issues. Doesn't necessarily mean that it takes away the need for any providers, doesn't eliminate need for counselors or physicians, etc., but it is a way to help fill in the gap. So you can think very broadly there. Another thing that you can do is partner with a local counselor in your area to provide support groups or offer counseling, maybe even out of the offices of the church, the space from the church. If you're looking for counselors in your area that might be interested in doing that, please let me know. Again, we have a network of counselors across the state, and I'd be glad to offer any of those that might be resources for you and could come and develop support groups within the church. Again, you have to remember this is something the church needs to support, because if it's not something that has buy-in, so to speak, from the church members, then it's going to be more difficult and more challenging to make this successful. But that is another way to maybe ease the burden a little bit of some of the cost or volunteering aspect from the church, but still offering something through your church that can be helpful to the community with regard to mental health issues. Another aspect of this, similar, is you can partner with a local group to provide support groups or education. You want to make sure that these individuals, and actually anyone who's involved in any of these support groups, has some experience with these types of situations and backgrounds and topics and so forth. It's not always the most helpful if you have someone who's willing, but they don't have the knowledge and experience behind it. That actually could end up being a detrimental situation. So I have a few listed here. Again, not exhaustive, and you're going to get some of the links for this in the follow-up email. The Alzheimer's Association is a great group if there's a chapter in your area that you could connect with for possibly support groups. You could connect with for possible having them come out to do some presentations. And they also may have caregiver support groups, which is a significant aspect of dementia. Those are caring for loved ones with dementia. It's usually a pretty significant need. If you're aware of the statistics with regard to the number of dementia that we anticipate will continue to expand over the next few years, we expect that's going to increase the number of individuals with dementia. So that might be a helpful thing. You might have a local hospital that could come out and do a diabetes support group or some type of cardiac support group. I know a previous hospital that I worked at, they had a diabetes support group. They would probably love to have the opportunity to extend that to a local church, not just the hospital. Cancer groups is another one. Excuse me. Maybe you have in your area a domestic violence group, an advocacy group who could come out and either offer training or education or help to offer some support groups periodically. Children's advocacy groups. There's the children's advocacy groups that are located all across Texas. I also used to work with one of them, and I know that they would also love the opportunity to partner with churches, whether it's for education and training, support groups. They would love that opportunity. There's even volunteer opportunities there as well. Parent training, maybe that's something, there's a local group in your area that could come out if you have a lot of young families in your church, and it would be helpful to provide parent training. That is an option. And then kind of one that a lot of people don't think about, again, getting back to the fact that mental health is a holistic issue, is there's nutritionists and dietitians and so forth that might also be available in your area to come out and talk about how diet and nutrition support your mental health issues. So I differentiated this particular list by saying that they're less than $200. These are still low cost options, but there is a little bit of cost to these, as there could have been for some of the others if you purchase books and so forth. And again, you'll get all of the links to these particular ministries, and this is just an example of some common ones. Mental Health Gateway in Houston. It's actually part of the Hope and Healing Center, but the Mental Health Gateway is something that was designed specifically for churches and clergy. And I've had a conversation with them and know that not only do they provide education and information, but they actually want to work with churches in kind of a consultation manner to help you figure out what the needs are, what does it look like, what do we need to offer, what could we offer, and then they also have free training to help to train those who might be coaches, mental health coaches, and support people for groups and so forth in your church. Fantastic resource, much more available than even what I could go into here. But that would be a low-cost option to get started if you want to look at and have someone to kind of help support you in getting something started. Mental Health Grace Alliance in Waco. They also have a great story about ministry and how they became involved in mental health concerns and issues. But they have a couple of different curriculums, one for adults, one for family members, one for teenagers, and one for young adults, I believe it is, or families. So they have a couple of different curriculums that they can use over a 12-week time. The purchase of the curriculum is somewhere between $20, maybe $25 at the most. And then they also offer a free training for anyone who wants to lead those groups. So they're another resource that can help to equip you, but then also be a low cost with regard to the amount of expense that your church might incur in regard to this ministry. HandsOn ministry is actually something that is connected with Texas Baptist. If you're familiar with Texas Baptist, you know that we have a chaplaincy department where we have a lot of over like 600 or 800 chaplains that are endorsed throughout the country and the world, actually, through the military. And HandsOn ministry is a volunteer chaplaincy training. Now, what I would say with this is there is a little bit more of a cost. I think to attend the training, it can be up to $150, but they could come to your church and train. There's also some online opportunities, and there's a variety of ways that you can engage with them. They also have, you'll see a little bit in another slide, a kind of a partner training that's called disaster recovery, where they can help to equip those when disasters come. That way you would be trained and ready to go and minister in the event of a disaster in your area. Light University is actually a group through the American Association of Christian Counselors. They provide on-demand online resources, and right now they have a program that's going through a grant where they can offer, a lot of online coaching type courses for those in churches who would like to start mental health ministries. How this program works is you sign up as a church, and then you pay, it's a technology fee of, I believe, $18 a course. There are either 3 or 4 courses total, and those particular courses come up to about $54 that you would have to pay for the technology fee. But at that point, you have access for a number of people at your church to be trained online. That's exactly what they want to do, and it's a variety of contexts with regard to mental health topics. Hope for Mental Health is a group and a website that was started with Rick and Kay Warren through Saddleback Church. You may be familiar with the fact that they lost their son to suicide many years ago, and they were already aware of the mental health conversation before then. But this particular website, not only does it have a ton of resources, webinars, etc., to familiarize yourself with mental health topics, they also do have a mental health ministry starter kit. So that might be another helpful thing for you to consider. And it has testimonials, DVDs, again, to kind of help prepare and educate your church on what these issues are. That might help then to set a stage and a platform for further discussion on what can we do as a church? What does that look like? And again, that particular cost is less than $200. If I remember correctly, the starter kit is less than $100. And there's a lot of information and resources that you can access even on that webpage. I'm throwing in Prepare and Enrich here because many of our ministers are familiar with Prepare and Enrich. They actually have several different programs, not just the preparation and education for those who might be offering premarital counseling or marriage counseling in ministry. They have something called Marriage Mentors, as well as a couple of other programs. But again, marriage may not be something that you think of as mental health right off, but many individuals are living in very strained marriages. And of course, that's going to affect your mental health, your emotional health. So if you feel that your church would be better equipped to serve in this way, maybe you consider Prepare and Enrich. And again, that particular training is less than $200. And there's a whole program that's set aside. They walk you step by step on how to do that. There's curriculum, books, videos, etc. with that. Let's talk a little bit now about mid-range cost options. And I've defined that as between $200 and $500. Now, again, not exhaustive, but there are some ministries here that you might have heard of and be familiar with. There's a group called Church Initiative. Church Initiative is kind of a parent company that has several different platforms you can access. And you see those here: divorce care for kids, grief share, which you've probably heard of, single and parenting. And all of these options are available through Church Initiative. They all have training. They all have curriculum and video that's available. So this is a situation where you might have someone who's willing to go through the training and receive the education and preparation, and then they could turn around and lead those groups. But in leading those groups, you usually utilize videos or resources that the platform provides, so that you don't have to come up with your own curriculum. It gives you information on how to lead these groups well, how to structure them, how to market them, all of those types of things in order to try to set this stage to be a successful ministry for your church. Then Celebrate Recovery. Probably many of you have heard of Celebrate Recovery. One of the things I will say about Celebrate Recovery, a lot of times we think of that as a ministry for substance abuse, but Celebrate Recovery has a broad umbrella. And what they actually say is that they are there to serve people with hurts, habits, and hangups. And that really can kind of count any of us in. I know I personally have been a part of Celebrate Recovery groups that were a little more focused on eating disorders. I know Celebrate Recovery groups that have been a little bit more open, shall you say, to individuals who range with all types of concerns that they might bring to the table, whether it be substance abuse, whether it be trauma, whether it be pornography. There are a lot of different things that this particular ministry can cover. And it doesn't have to be individualized, but again, if you look at the needs of your community and you think it needs to be a little bit more purposeful or nuanced, you can certainly do that. There's the capacity to do that with Celebrate Recovery. I've listed here about 5 of their curriculums that they have. They have more than that, actually. Celebration Place is designed for kiddos. That's actually for children 12 and under. The Landing is for teens up to 18. They also have some very specific curriculums that are related to cultural communities. Many times these communities are underserved, and they're also, unfortunately, there's a more stigma oftentimes in our cultural communities about seeking counseling or seeking resources for help. So they have some specific curriculums to try to meet those needs and speak to those groups effectively and well with regard to mental health. Then they have a track that's just mental health. Something that you could offer that is not specific to substance abuse or any of those types of things, but very focused on mental health concerns and mental health issues. They actually have a curriculum also called Welcome Home. Welcome Home is designed for veterans. And so if you live in a community where there's a military base around, if you live in a community where you and your church, you serve a lot of veterans in your community, or maybe they have been hesitant to come to your church, but you know that there are veterans that are hurting in your community, that might be a curriculum for you to consider. Now, with Celebrate Recovery, what I will say is in order to be the most successful with Celebrate Recovery, there's a couple of things I would suggest. One is actually attend their training. They require you to attend the training if you want to have your Celebrate Recovery listed on their website. On their main website, they have a local Celebrate Recovery Finder. And if you want to be listed as a Celebrate Recovery group, you have to go through their training in order to do that. And I would suggest that you go ahead and go through that training. It's a time-honored, time-tested program. It's done the way it is for a very specific reason. And it would be great for you and probably the most successful for you as a church if you attend that training and actually understand the underpinnings of what Celebrate Recovery is all about. They have in-person trainings, they have online trainings, they actually have a conference that's coming up, I believe later on in May. So there are a lot of things there that you can have access to. The conference and trainings is somewhere between $200 and $500. It's actually a little bit more on the 250, maybe 300-ish, depending on how many people you might have attend that particular training and involved. But I really would encourage you that if you're going to go the route of Celebrate Recovery, that you peruse their website, understand the foundational aspects of it. And on their website, something that I would say is relatively new, I just discovered in the last couple of years myself, they actually now, because they're such a national and world recognized organization, they actually have state representatives in each state that can help you in having the conversation of, would this be a beneficial ministry for my church to start? What does the need look like in my community? They can help you to assess that. And they have, like I said, they have state representatives, many of them that are located across Texas, who would be glad to engage with you on those topics and help you to understand how to do a Celebrate Recovery type ministry if that's something that you're interested in and you want to look for. Now let's talk about some higher cost options. As I mentioned, there are many different ways to approach mental health and a ministry in your church. And I really wanted to highlight the lower cost options because I think sometimes our minds go to, it's got to be big and it's got to be grand, but it really doesn't have to be big and grand in order to have a significant impact. Now, if your church is in a position where you have a pretty large congregation, you have a lot of time, a lot of energy, a lot of people that can contribute to a mental health ministry and would be engaged and invested in that mental health ministry, you might consider something like a Stevens ministry. You may have heard of this one before. I know I had heard of it many times and actually just contacted them to make sure I had information available to present to you. The Stevens ministry is very structured and very organized. So if you determine that you want to go the route of a Stevens ministry, you do need to go through their program, which can actually be, the training itself can be around $1,200 or so per person, but let me explain to you how it happens. A Stevens ministry, you have 2, 3, maybe 4 individuals in a church congregation that go through the core training. And once you go through that core training, you have access then at that point, and you have been trained so that you then can train other lay leaders in the church. So if you go through that ministry, the idea here behind Stevens ministry, if you're not familiar with it, is a little bit more life on life type ministry, one-on-one ministry. So if you have someone who goes through Stevens ministry becomes a trainer, then they would have individuals that they train there at the church who would walk with on a weekly basis, one-on-one congregant members. So you have a way to pair them up. That's part of their curriculum. You'd have a way to, they would be trained on questions to ask, questions that they don't necessarily need to ask when they need to reach out for help, when it's beyond their scope and so forth. But they're really there in the Stevens ministry to be a little bit more of a listening ear, a prayer partner, to help walk alongside and listen to some of those struggles that might be going on. They're not there as fix-its, and they're not there as counselors per se. It's not to replace any type of mental health provider. But this is a ministry where you would have one-on-one. So if someone, a lay leader in the church, has someone that they are working with, they would only work with one person at a time. You don't set them up with 3 or 4 different people. They have one person at a time that they're assigned to over a period of time, and then you can evaluate what the needs are and decide what you want to do next. Stevens ministry is a fantastic ministry, and I think it is definitely needed and well utilized. But I just want you to be well aware of the cost and also aware of the the level of commitment that's involved in something like that. So you can start to evaluate on the front end if that's a ministry that would benefit your church, or if it's a ministry that even your congregants would be engaged in and they would support, if there's enough energy and volunteers to be able to engage over long periods of time in that type of ministry. Certainly, you could start a counseling center. This is a question that I receive on a fairly regular basis. I honestly don't think every church needs a counseling center, and here's the reason why. A counseling center has a lot of moving parts. There are a lot of legalities, and there are a lot of things that you need to consider. So when thinking of a counseling center, I'm putting it in the category of it's going to be more than 600 startup costs, so to speak. And then you have to consider maintenance. You have to consider somebody, who's going to be in charge of this ministry to make sure that there's promotion, to make sure that there's guidelines that are being followed, that are being met. Again, I'm not saying it's not doable. I just think that you really have to go into it with your eyes wide open. There are additional liabilities that can come up related to a counseling center at your church. And depending on if you have multiple counselors, if you're working with them on a contract basis, if they are employed by the church, there's a variety of ways that this can happen and can be done well. But I also know in the last couple of years that I've seen churches close their counseling centers because they have become either a little bit more than they can maintain, a little bit more than their budgets are available to help with. And so you really just have to think through this ministry. I will say that probably what I see more frequently are churches that contract with counselors to utilize space within the church. And that might be a more cost-effective option. But again, keep in mind, there are legalities that come with that, and there are liabilities and so forth that come with that as well. So you want to make sure that you have considered all of those things before jumping into a counseling center. It's a great idea and can be a great opportunity, particularly if your community is underserved. But I do know of a situation, and this is where church support is really important. I know of a situation several years ago where a minister was really, really excited, saw the need for a counseling center. They were definitely in an underserved area, and it would have been a much needed service in their area. However, I asked the question, have you talked to your church about this? That particular individual at that time had not, and they said, okay, I'll do that. Come to find out, when they presented it to the church was not in favor at all. And there was a variety of different reasons that they were not in favor. But my point here is just make sure that you have that support. If you're going to start something like that, just know that it can have some, like I said, a lot of moving parts and a lot of different things to try to stay on top of. So know that you're going to have to go into it with time, money, energy, and really be engaged. It can work well. Just know that it also is going to take some work to make sure that it's successful. Another opportunity that you might consider is if you're not ready to jump into a ministry per se, but you want to start to do something. One of the first suggestions, if this conversation about mental health has not been on your radar, your church's radar at all, one of the first things that you want to do is just start to talk that up and start to mention that in your sermons, mention that in conversations about, I'm seeing a mental health need. I'm seeing this in the community. What are you seeing? What are your thoughts? Do you think it would be helpful for us to start a mental health ministry? In sermons and in your, even when you're praying and so forth, mention that you're praying for those who are struggling with depression, praying for those who are struggling with anxiety. There's actually a book called Troubled Minds that really kind of helps the church to start to have this conversation a little bit and start to think differently than we oftentimes do about mental health issues. But if you've never had those conversations, then what I would suggest is then rather just jump blindly into a mental health ministry is start to have the conversations first. And one of those ways that you can do that is to partner with someone to offer a training at your church. There are groups like Mental Health First Aid. This is an 8-hour training. It can be broken up in some different ways, but this is an 8-hour training. It's a national training. Think along the lines of what we think of with CPR, but mental health is that crisis response intervention for mental health, rather than CPR obviously being intervention for cardiac issues or a stroke, someone who's lost consciousness. This is not a medical, but the mental health aspect of crisis intervention. That's just an idea. There are other groups that might be well-versed in coming and offering a training. That's something to consider. But no, if you do offer something like that, there is possibly going to be a significant cost to that. It really just depends on the group and the trainer and how you want to structure that entire training. Trauma ministry, we actually have a friend of Texas Baptist named Dr. Ernest Izzard, who several years ago felt the need, the call to help equip churches with trauma. We know statistically, again, that there's a lot of mental health issues, and there's a report survey that was done several years ago called the ACEs study. And that revealed to us that there are actually many people who are living day in and day out with trauma that impacts their lives, or they've had a lot of risk factors that impact their mental and emotional health, but they may not have identified those things, and or they haven't sought treatment for them. So you probably have people in your pew who have experienced trauma. And Dr. Izzard, with his trauma ministry, what he's wanting to do is help educate churches on how to become trauma informed. And what this means is, how do we put on the lens of, if I am someone who has experienced a trauma, think about children's ministry. If you have children who might have experienced a trauma, or they've come from traumatic situations, maybe there are different ways that we can interact with them in children's ministry. Maybe there are different ways that we can approach our regular church services that might be more friendly towards those who have experienced trauma. So trauma ministry would be another training. Again, there are different options there. You'd have to look at how much time and the interest and so forth, but that is something that you could contact him and seek out information from the trauma ministry. That might be something that you do in the fall and just see how things go. And then based on that information, determine whether or not you want to start a weekly or a monthly type of ministry. So these are just ideas to kind of help get the ball rolling. I've already mentioned the hands-on ministry, and this is where I included the disaster recovery part of that. Again, hands-on ministry being a kind of a volunteer chaplain type of training. It's pretty extensive, and it can help you to know not only a little bit about different types of mental health issues, but how to respond. Things that are helpful to say, things that are not helpful to say. Things to, of course, it'll talk about listening skills and so forth, but things that would help from a spiritual standpoint, things that might not help so much from a spiritual standpoint. And then the disaster recovery aspect of that, which is more focused on responding to the disaster. You may remember or think of church shootings, or certainly hurricanes and tornadoes and all these different things. We oftentimes, as Texas Baptists, we think of Texas Baptist men that go and serve in those capacities. This type of training is an additional training that could either help you to be prepared to go if there's a disaster that you would like to serve in, or that you would like to be available to go and help. Or it can just be additional information for you to have if there were to be some type of disaster directly in your community and you're prepared to assist. Maybe even partner with your local fire departments, police departments, etc., to try to figure out what that looks like for your community. Again, I grew up in a smaller community, and so I'm thinking of our volunteer fire departments and people that could probably use a helping hand in some of these types of situations. So that might be a helpful training for you to consider bringing to your church. There's more information that you will get in the handout that I'll be sending to you. So you can click on the link, look at the actual pricing, look at the number of hours, etc., and see the contact for all of those types of things. Lastly, that I have here, which could be a higher cost option, but again, a thought just to kind of get the conversation going, you could invite a speaker to your church to present on mental health issues. Maybe you have this on a Friday night, maybe you have it on a Saturday, whatever you think might work best for your particular setting. But some of the options that I have listed here are actually related to the groups and organizations that I've already mentioned to you that are set aside, have already started ministries to help you have a church mental health ministry. One of those is Joe Padilla. He's actually the co-founder with Mental Health Grace Alliance in Waco. He's a fantastic speaker. He has experience in ministry, and he might be a great person to bring to your church to kind of help set the stage for. Also, he can subsequently, if you wanted to, bring a team and they can help to train individuals in the church that might be interested in launching a mental health ministry, particularly using some of the curriculum that their group puts together. So that might be an option for a speaker. Dr. Matthew Stanford, he is the director of the Mental Health Gateway program that I mentioned. Fantastic, so knowledgeable, has a passion actually to help churches and ministry leaders kind of step into this gap. He is someone who would probably love to come to a church gathering or present at a church, and he would be a fantastic individual to bring in for a conference or something of that nature if you're wanting to have a presenter to talk about why should we do this, what should we look at doing this, and start that conversation. He would be a fantastic presenter on many levels, but that would be one of the ideas to possibly bring him in. And then, as I've already mentioned to you, Dr. Ernest Izzard, he is the one that's related to the trauma ministry. And I know that from his own experience, again, he's served as a pastor, served as a chaplain. He is a survivor of trauma, and therefore he really understands it and is passionate about it, has a lot of great information that he can share with you as a church so that you can try to figure out, as we navigate these conversations, what does this look like for us? Where are we? Where can we improve? Where do we need to start? What do we need to do? He's someone who can help you to figure out those types of things. So as we kind of narrow and wrap up the conversation today, what I want to hopefully leave you with is there is something that you can do to help fill the gap. And I have a picture here. I've used that terminology several times. Had the opportunity to go to England several years ago. And if you've ever visited there or heard this terminology, in the tube, which is their subway system, between the subway, between the actual cars and the platform, there is the statement that says mind the gap. And what I hope to do is that as you are considering a mental health ministry and considering what this might look like, where do we need to start, evaluating that landscape, I want to be here as a resource for you. And I want to encourage you to not shy away from trying to help fill the gap. As I mentioned, mental health providers right now are pretty stressed and strained. It's oftentimes difficult to get into a mental health provider right now. And so as the church, we can help to step up in some ways and provide some additional support there, not taking the place of any of these providers necessarily, but offering some support that in most instances is lacking from a holistic perspective within our mental health services that are currently out there. So I would love to help you have that brainstorming, have that conversation. And if you are interested in additional conversations after today, then by all means, I want you to feel free to contact me to do that and have that conversation so that I can figure out how to help support you. Thank you so much for joining me today. I hope this has been helpful information. And if I can be of any assistance to you in answering questions or providing resources, please let me know. And if you'd like the handout that was mentioned in the video, just send me an email and I'll be glad to send that to you. You can find my contact information in the description. Of course, you might want to back it up a little bit in the presentation as well, and you can find it there. Thanks so much for joining and have a great day.